And then we have oxytetravet aerosol. This one, very, very helpful when you're trying to treat wounds, when you're trying to treat, let's say, foot rot and so forth. After you've squeezed out the pus and so forth, is on the swelling, it's important to spray this on the wound. Trying to remove dirt from the wound, you use hydrogen peroxide. This is very, very good for keeping the wound clean as you try to administer other medicine. Then we have multivitamins. This one helps so much when you want to boost the energy level in your animal. The animal may appear weak when it doesn't have appetite. We normally apply multivitamin. However, multivitamin in most cases is administered together with another drug. In this case, we normally use it together with the oxytetracycline, meaning that once you inject your animal with multivitamin, it will treat the diseases, some of the challenges the goat may be having. But for those that it may not be able to handle, then oxytetracycline comes in to be able to support the animal further. So it's normally given in combination with another drug. And then we have anti-parasitic. We have two types. We have those that are injectable, like ivermectin. This is for treating, for instance, of worms and so forth, but it is administered to the animal through injection. And then we have levamisole hydrochloride. This is Wormicide brand. This is administered orally. Remember, when you're deworming your animals, it's good to always interchange. When you use injectables, let's say after 3 months or 6, you can change and use orals. But also there are cases, for instance, when the animals are pregnant, depending on what your veterinary doctor will tell you. There are certain medications or drugs that you cannot give, for instance, a heavy goat that is about to give birth. So when you have the oral one or when you have the injectable one, he will guide you on which one to pick and treat the animal. I've also brought acaricide. This is basically for spraying. But the most important thing is that all these drugs have active ingredients. So for this Sangatraz, for instance, the brand we are using, it has amitraz as the active ingredient. But once we apply and we spray our goats, say, weekly, for say 5 or 6 months, we'll change and look for another acaricide of a different active ingredient. So as you use all these, you remember you need to have an injection with its own needles. You need to have gloves, very, very key. You need to have a thermometer. Sometimes the doctor will tell you, first get the temperature of that animal and tell me, before he can prescribe or advise you the medication to use if it's not readily available to come on the farm, on your farm. So you can imagine having all this on standby on your farm. It makes it much easier for you to manage situations. You will not go into panic. For instance, if you got a challenge on a Sunday and the vet shops are closed, you are able to tap into this because your vet doctor is always, for instance, a phone call away.